Okay, guys, we're going to talk about a little bit about Crohn's and ulcerative colitis now. Let me start by telling you some of the similarities for Crohn's and ulcerative because they do have some fairly common similarities. So they both have the inflammatory process, the flare-up, they have flare-ups and remission of these inflammatory sessions where they become inflamed and then healed and then inflamed and scar tissue. It's just kind of an ongoing problem. The cause is unknown. It is said that it could be the immune system in overdrive and it could be genetic. So unfortunately, when you see these patients for both actually in the hospital, they're usually very thin and gaunt and that have flare-ups a lot anyway because the mucosal layers of the lining of your GI tract just really gets worn down and stiff and hard, and so no absorption of minerals or nutrients are going into their system, or very few. So they're just not getting the nutrients that they need. Same with fluids. They get very dehydrated very easily. So what the differences are with Crohn's, first of all, that is throughout the GI tract. Okay, so there's some very similarities. However, there are some major differences as well. So Crohn's is throughout the entire GI tract. It affects the lining of the intestinal walls, and it also affects all layers. So this is a picture right here of Crohn's, and it affects all of these layers, just like some of the other diseases that we were talking about. So it can erode, go through and cause that peritonitis, right? Sometimes there's sections in here that they can actually cut out to take, if it's just one section that's really inflamed, and that's when you might see a stoma. Okay. Fissures, strictures, obstructions can happen because you see how scarred this is, and there's not much movement at all going on. Painful, so they don't even want to eat because this is going to be painful as that food is being digested, partially digested, and going through their system. So the treatment for this are a couple of things. We can do anti-inflammatories. So the 5-amino salicylates called sulfasalazine, that is an anti-inflammatory that can be used, as well as the steroids, but we have problems with steroids, right? When we take them too much, we need to taper them off, and we also need to watch for blood sugar and the patient being immunocompromised, which is difficult because they would be at high risk for this patient for having cuts and strictures and then possibly bacterial infections in here. Let's see here. We can also use immunomodulators or immune suppressants, one of them being Imuron, which it decreases the immune response, or another being adalimumab. And that is a TNF, a tumor necrosis factor blocker. So it blocks the inflammation from that particular protein. We give antibiotics as well, and then also if they are having diarrhea, which they a lot of times will have with this, then we can give them loperamide to treat that diarrhea. Metronidazole or Flagyl is a great antibiotic that we can use, but as you could probably tell, this patient might be on antibiotics a lot, and so the flora is going to be gone in their GI tract, leading to C. diff. It's just a really bad cycle. And then the steroids, and hopefully we only have to use those for their flare-ups. So Crohn's, anywhere in the GI tract, affects all of the layers, can be found in scattered patches in the GI tract. You can get abscesses and then peritonitis and sepsis. Okay, so now let's take a look at the ulcerative colitis. So the ulcerative colitis is, again, inflammation of ulcers, just like the other. However, this is in the large intestines only. It does affect the inner lining of the colon and the rectum, but it doesn't go all the way through. It doesn't go through all of these, all of the lining like Crohn's does. So I did put a picture up here of a lip with a cold sore on it. And obviously that has nothing to do with ulcerative colitis. But for those of you that have had a cold slaw, you know, cold slaw, okay, can't say that right. Cold sore, there you go. It's extremely painful. So now what I want you to do, and it's really painful to touch. So think about ulcers inside the GI tract, inside the large intestines, when food or you know, your GI tract starts to have secretions and tries to move, any sort of movement is going to be extremely painful. So I kind of wanted you to think about that. Not that it's just, oh, it's ulcerative colitis, but think about what it might feel like for the patient. The ulcers can become infected, so they can burst, they'll have pus in them. Your GI tract cannot do its job properly with decreased water and mineral absorptions. They're going to have diarrhea and electrolyte imbalances, similar to Crohn's. And the treatment for this is the same as Crohn's as well. So all of the medications that we talked about in Crohn's and what you'll hear on the pharmacology spreadsheet is the same. Okay.